prepared were you for things like that? Was it a big adjustment, or were you halfway there?
Well, let me put it this way. We started this whole exercise sometime in January, and our guys had basically started sharing the fact that it could get to us, and had made all the arrangements for us to be able to work from home. But it's never the same thing like when it actually starts. But in fairness, I think we're getting very comfortable with it more and more.
Okay, that's great. So thank you for joining us. We're here to talk about your work with the Coalition Against COVID and
Right.
you know, the work that you are doing alongside other CEOs and captains of industry, if I may use that term. Can you tell us how all that came about? Did it come up quickly, or you know, who made the call and said, Herbert, I want you to donate 1 billion naira? And you said, of course, here we go.
Let me put it very simply. I mean, I'm sure you understand how the private sector works in Nigeria. When all of this started, it was clear to us that some of us needed to start something and create a private sector platform that was going to partner with government in this fight, and that we couldn't leave it to government alone. It also could not be just one company or just one person. And so Mr. Dangote and myself basically pulled together a few people and expanded the list after that, because we realized it was a much bigger thing than any of us could possibly handle. And so we called typically on people who have great competencies in solving things like this to join us. So it's a combined effort of a large number of public-private sector names, quite close to 50 as we speak, and growing. And the whole idea is we must work together as a cohesive team to fight this pandemic to zero.
Yeah. So how much has been raised altogether now so far?
I think about 23 billion has been raised. There's an additional 20 we're seeking to raise, because there are different things being done. As a starting point, there are two levels of interventions. First of all, we're creating isolation centers. We're creating testing arrangements. We're importing all of the equipment required, PPEs, et cetera, making sure there's adequate medication. And then the second, which is just as important, is that we're going to have to provide food for the bottom of the pyramid, for the 5% bottom of the pyramid. And that comes to, you know, about 10 million people, which is about 1.67 million families. And we need to make sure that that food basically gets to everybody.
Sure.
The World Food Program has some minimum expectations. So basically, we have to surpass those expectations for us to ensure that these people are fed, and to ensure that at least the social fabrics of the system is not destroyed in the course of staying at home.
So let's talk about a few things. You know, there's a lot of misconception about this money. Who is administering the money? Is it the federal government? Is it a mixture of both, or is it just this group of private individuals?
It is this group of private sector individuals. The money is in the Central Bank of Nigeria. There is a very clear governance structure around how the money is raised and how it is used. You have a technical committee that looks into the technical details of how do we resolve this pandemic. It looks at things like what type of equipment do we need to import, you know, what type of PPEs, what do we need for ICU, et cetera, all right? So that is one committee. And at the end of the day, there is a figure that is put to all of that. You have an operational committee that deals with the logistics of the rollout, that deals with basically liaison with other institutions that are doing the same thing, and, you know, where can we collaborate together so that we don't duplicate efforts, that deals with communication, all right, to the general public, all right, and sharing the information, issues around hygiene, training, et cetera, And then there's the fundraising committee. So you have all of these three sitting behind a supervisory team that is making sure that things happen. So there is no money that is being given to anybody. There is a proper governance arrangement around how the money is utilized, all right, for the two types of interventions. And there is no cash being paid to anybody.
Okay. So I just want to clear that up, because there's so much misinformation around this money that the federal government has taken it and they've spent it. We don't know what they spent it on. So I'm glad to clear that up. But, you know, one thing you mentioned
Stephanie, I will even tell you what we're doing. The levels of transparency go as far as us sharing where is this money coming from. And every 30 days, and we're getting to one now, we have KPMG come in and set out the books, and everybody sees what was spent and what was it spent for and how much is left. All right, so it is very clear. So we're not giving the money to But remember that we're partnering in doing all of this. So we know exactly what the government wants, and we know exactly what to do.
Okay, well, that's good. One of my questions was going to be, what is the auditing process? So I'm glad you've cleared that up. But you mentioned about reaching the lowest strata of society in terms of giving food and, relief items. We're seeing so many reports of people saying they're hungry, people, unrest, images of unrest and things like that. What has been done so far in terms of giving those relief, and how much more will be done from your side of things?
So we start by next week to start to distribute food. Remember that this whole effort it's a big logistic operation, okay? And it's one that we're trying to make sure that we sequence the creation of the isolation centers, et cetera, as well as making sure that we provide food. And how do we make sure that we do this without touching or disrupting the overall price framework of food in the country? So this should start by next week. All right. There will be a trial run. All right. After which it will be sent across to the whole country. Now we realize that it's a big logistic operation, and so we're going to be partnering with government, with local governments, to make sure that at each level in the wards, all right, families do get enough food to last them a month. And it's basic things. It is rice, it is gari, it is pasta, it is noodles for children, it is sugar, it is salt, things like that, to make sure that families can survive. But we understand and all the apprehension and pain people are going through, all right? But these are people who have raising money from private sector to make sure that this thing happens, working with government. And I think we'll get there. It's just a very painful exercise, and we know how people feel at this time, 2 weeks after a lockdown.
Yes. So I'm curious how involved your group is in the administering and delivery of, these relief items, because we're seeing also reports of people being asked to show political affiliation cards, and also people having food clearly that is not sufficient for entire streets, because the people who are giving out the food have clearly taken some of this and given not enough. So how do we, ascertain accountability and transparency in the stuff that you're giving out to make sure it gets to the right people?
So let me tell you how it is done. So you have, for instance, all these items are bagged separately, all right? And they're well branded, COVID, not available for sale. So nobody can sell any of these things. That's the starting point. And there will be very clear communication to the public that is what this thing is being used for. Now, having done that, obviously, you need to work with the state governors, you need to work with local government chairmen, all right? And then you need to work at the ward levels in the states, in local governments, to get there. Now, I know for certain you will not succeed 100%. But if we succeed 85% in getting these things down to the masses, it's fine. And we will typically give it to the female heads of households who will ensure that there is food at home. Okay. Now it is different from paying cash. If you want to pay cash and you pay it to men, you don't know how it's going to be spent, unfortunately. Two, how do you determine who to give it to? If not, that would have been the easiest way to basically make sure that these things happen. So the idea is, let us try as much as possible. If we're 80% successful in reaching 1.67 million Nigerians, I think we would have done a good job.
Yeah. Okay. Well, it's commendable effort, certainly. And so let's talk about the isolation centers and things that your group is building. And I know you're building all around the country, in Port Harcourt, in Kano, etc. Is this strategy been developed in line with the NCDC? I mean, are we preparing for mass outbreak? I mean, what is the thinking behind that?
So in the technical committee, you have the NCDC representative, you have somebody from Bill and Melinda Gates, you have somebody from the World Health Organization. All right, you have people who are adept at this whole thing and who are extremely competent and understand how infectious diseases basically spread. Now, so the first place we basically set up was in 6 states in the 6 geopolitical zones, and we looked at places where the incidence would be highest. So there was Port Harcourt, there was Abuja, there was Lagos, etc., Kano, etc. Now we've started the next 20 states, all right? And we're working with PwC to ensure that there will be a convergence at a particular point in time, and I think that will be in 2.5 weeks' time, when we would have been present across the whole country. Obviously, the demands in each state will not be the demands in the others. Lagos is the epicenter. it's not likely to have the same type of the same type of outbreak, for instance, as some other parts of the country. But we will make sure, because the nature and manner with which this disease spreads, all right, at the end of the day, all right, can go anywhere. So we will make sure that we are present across every part of the country. That's one. Secondly, a COVID center is a standard COVID center and is certified to be able to handle issues around COVID. So you have things like the beds, you have the nature of equipment, you have PPEs, you have BPAPs, you have, in some cases, very few, what's it called, ventilators, all right? Even though sometimes it's questionable whether some of these things should be used or not, if you get the point I'm trying to make. But we try to make sure that each center in each particular state should be able to handle the needs of that state. Hopefully, should there be an outbreak. We pray that at the end of the day, all of these things will not be required, all right? But it is better safe than sorry.
Sure. So the thinking is build new isolation centers in anticipation of these potential cases, because we do have relatively low number of cases compared to other parts of the world. So that's the thinking behind that.
I've had that thinking, and I've had that it is possible that we probably have a genetic predisposition that makes us less amenable to all of these things. But if you go to a country called Ecuador, that has similar circumstances like us, when the outbreak actually did happen, there were hundreds and thousands of people on the streets of Ecuador. Now we are preparing for the worst and hoping for the best. Okay. I think that at the end of the day, we may not see the same levels of incidence as some other parts of the world. We hope we don't, but let us prepare ourselves. Should it ever happen, let us be able to flatten the curve very quickly.
And so how is this group helping with testing capacity, which is quite low? I think Nigeria is one of the lowest on the continent. How is your group helping with those efforts?
So today, this evening or tomorrow, we should be able to have about, these things are rationed internationally, some of them, based on the incidence of death and all of that. All right, so we have 38,000 molecular testing kits, and I'm not talking about the rapid kits that don't give you an exact result. All right, they should come in today or tomorrow. We have a rush molecular testing equipment that can test 1,000 people a day coming in as well. All right, now the 38,000 molecular kits are part of 250,000 which we're expecting, so that's coming in. We ordered 100 PCR testing equipment. Unfortunately, we couldn't get all of it. We could only get 10 or so. So that's also coming in. I think with this number, together with what exists in the country right now, we'll be able to step up the overall testing capabilities of the system. And if you just take the incidence of where we are now, it would at least give us a big leap, all right, in terms of our testing capabilities, while we continue to make other arrangements.
So why were you not able to get the testing kits that you ordered, the PCR?
Because it is rationed now. Everybody in the world is struggling to get it. And the way it's being rationed is according to how many deaths you've experienced in your country.
Right.
Ideally, we shouldn't have gotten much, all right? But we're able to basically get all of this to help us. And quite frankly, if you have that rush molecular machine, which basically can do 1,000 a day, you will do quite a bit in Lagos together with what we have. The PCR machines can be deployed to the states as well. And then we have the molecular testing kits, which are just, but that's just about 250,000. I think with those ones, it can carry us, quite a bit before we try and see how much more we can get.
Okay. So from all the work that you're doing and, the efforts you're making, what opportunities do you see for Nigeria in terms of other revenue streams, Nigerian manufacturers perhaps? What other opportunities are there so that we don't depend so much on external, imports all the time? What opportunities can we take forward from this crisis, from what you're seeing?
I think if there's one thing that we're going to learn is the fact that private sector capital has to go into our healthcare sector. We've not paid enough attention to it forever, all right? And that is why we found ourselves where we are. Two, that's word called medical tourism that takes a lot of Nigerians out of this country. It's just a disaster. We need to basically equip our country, all right, to support us at a time like this. It was Ebola, it was Lassa fever, now it's it's now, what's it called, coronavirus. We will soon find another one and all of that. We have not been able to build enough centers for infectious diseases. We've not been able to build enough good hospitals. I think this particular incident will enable us to start thinking a bit differently, all right, with a view to strengthen our overall, medical industry.
Yeah. And do you personally yourself, from the insight you're gaining in being involved in this, see any investment opportunities that you may pick up in post-crisis?
Several. I mean, if you had asked me, well, 15, 20 years ago, in banking, we would have supported the pharmaceutical industries, but we would support them at a very basic scale. And that is why most of those names did not stand the test of time. But today, I think for any banker who is worth his salt, who is basically going to be doing anything, we have to invest and invest properly in that sector. So it's not just about the hospitals, it's about the pharmaceutical companies, the production facilities, etc. And understanding that they can be profitable, but even if they're not that profitable, the social impact of getting these things running and protecting our people perhaps overrides every other thing we're doing.
Yeah. And also, in the same vein, in similar vein of the question, do you plan to perhaps expand any support that you give to SMEs and manufacturers in the country to be able to enable them to do these things?
Absolutely, absolutely. Now, for as far as any of these things can be manufactured in Nigeria, we support those companies. If people are making gowns, clinical gowns, things here locally, we don't import them. Anything that can be manufactured locally, down to face masks, we help them manufacture those things. And it's going to be ongoing, all right, because these things will always be required. So yes, those are some of the things we're doing. And particularly at a time like this when foreign exchange is scarce, we basically need to support local industry to do these things like that.
So are there any specific things that you're doing, to support SMEs in this period where there is a crunch? Quite frankly, they're not earning, they still have to pay salaries in some cases. What is Access doing as a bank to provide relief for SMEs in this period? And then going further, you may not have got the specifics, I suppose, but going further, what will change in the way that you support SMEs in their ventures?
Okay, let me put it this way. I think as far as the financial services sector is concerned, and for support for SMEs, we must be, one of the most significant players in that market. And it comes from the merger which we did. So it's evident in our portfolio. That's the starting point. The second is the fact that between the central bank and us as an institution as well, all right, we've come up with several palliatives for the SMEs. We don't even have an option. The SMEs actually truly represent the bane of the economy. And if you don't support them, they will truly die, all right, particularly at a time like this. Central Bank came up with a couple of initiatives to basically get banks to support the SMEs. But even before that, all right, what we had basically done was to tell most of them, let's reschedule, let's defer most of your exposures. And we do realize that you may require additional working capital to get started again. We will support you through that whole endeavor, all right? Otherwise, they're in trouble. To start a business, stop it, and think you can just start tomorrow. It doesn't work like that. Somebody needs to give you additional capital to get you going, all right, for it to happen. So that is happening. The second is, it's not just SMEs. You also have individuals. People have school fees coming up and all sorts of things. They've not been earning any income, all right? Somebody has to step in to provide all of those things. We need to rework our economy and get it going. I think it was the Ghanaian president who even put it very, very, very well. And he said, look, we know how to jumpstart our economies. We know what to do, and we're doing just that. What we don't know how to do, though, is to wake up people who have died. And so that is what is critical to all of us.
Yeah. So, you're more in favor of let's get this crisis under our belts. Let's tackle this before thinking about the economy. That's your...
Not quite. Three things
Not
at the
quite.
same time. Not quite. Three things at the same time. Just as you're solving the problem of COVID, you have to think of life right after COVID. All right. Now, so there is a medical issue around COVID, which you have to solve, but there's also the stomach issue around COVID, which is perhaps even more serious than COVID. All right. Because for people at the bottom of the pyramid, all they're going to tell you is that, look, before COVID kills me, hunger would have killed me. All right. And before you know it, they're doing all sorts of things. So as you're solving COVID, make sure you start solving the problem of the people at the bottom of the pyramid. At the same time, you must start asking yourself, what do we do with respect to life after COVID? What do we start doing with respect to the SMEs, all right, who you know are basically in a logjam right now? So let me tell you something, Stephanie. I've never been this busy all my life. So you're juggling with all of these things the same day. So you're seeing pictures, you're getting SMS messages about people who are on the streets and they're looking for food. At no time in your life would you have seen this amount of requests even coming from people you've not spoken to in 10 years about making a living, about being able to buy something very basic. And this is just the first 2 weeks in a lockdown. So you have to think of those three things. One, the medical. Two, the feeding of all the people. And the third is how do we get these people back to work as quickly as possible when all of this is over.
Yeah. So the COVID food distribution has started. Has it started?
We've started. You know, it's a logistic operation. So we've bought the products. Fortunately, we have several members in COVID who are huge manufacturers, and so they're bagging the products. Our expectation is that by next week it will start to go out, okay, and you will start to see it across. And of course, we'll carry it in the. People will see and know that that's what we're doing. It's not the easiest of things to buy products without distorting the price in the market as well. It's also a very delicate endeavor, if you like. So those are all the things we're doing, and you have to rebag them into smaller sizes so that you can go through 1.6 million families. But by next week, it will happen.
So just to clarify, you've identified 1.6 million families who...
So what we did, so let me tell you what we did. We took 5% of the population, which is the bottom of the pyramid, which is 10 million people. And then the idea is that a family is made up of 6 people, a man, his wife, and 4 children on the average. So even if you had more children, all right, this discriminates in your favor, technically, if you like, all right? Now, so this detail exists at the local governments and at the ward levels, all right? So we're actually going to take it through the state governors to the local governments and to the wards. Now, you will have a bit of mix-up, if you like, all right? But, you know, if there's a 10% mix-up at that point, honestly, it doesn't matter. And in any event, it is food. It will be eaten, if you get the point I'm trying to make. So that is how we do it. So you technically have data. I'm not sure if it's up to 1.7, but it could be in that neighborhood where we're basically going to share all of these things too. And it's going to take a little while. So even if it starts next week, it will take about 2 or 3 weeks for it to go around.
Sure. Okay, well, we're coming to the final few minutes. And, you know, I just want to come back to your company right now, Access Bank. How much is it fully operational, or, you know, what is the capacity that you're functioning at? And, you know, some people are complaining not being able to do certain transactions and things like that. How can you help with those?
So what we've done is we're running skeletal services at the head office. Of course, maintaining all the principles around social and physical distancing. We've kept a couple of places open to serve non-contactable type operations. So let's say you came to basically get a new ATM card, you can't get an ATM card. And in some cases, if there was need to move some cash, there are specific arrangements where that cash can be moved into without, again, ensuring that you're ensuring all of those things around social distancing